Today marks the start of a major test for vaccine mandates all around the country. While New York City's mandate for teachers to be vaccinated was put on hold by a federal judge, the mandate for the state's healthcare workers is going into effect. Now, those workers must now have at least one dose, and that's leading to fears of staffing shortages. An estimated 72,000 hospital workers are not yet fully vaccinated statewide, and that's about 16% of the workforce. We're joined now by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Good morning to you, Dr. Jha. It's always good to see you.
Good morning. Thanks for having me back.
Okay, let's start with the vaccine hesitancy among the medical workers. Because if I was a non-vaccinated person and I see healthcare workers are not getting vaccinated, I would think, do they know something that I don't? How do you explain the vaccine hesitancy among that group of people?
Yeah, so Gayle, the way I remind people is that 97, maybe 98% of all doctors are vaccinated, 80, 90% of nurses are vaccinated. So there really isn't a lot of hesitancy. It's a very small group. They're very noisy, they're very loud, and they make it look like lots of healthcare workers are hesitant, but they really aren't. Most healthcare workers have gotten the shot already.
Okay, that's really good to know, because you're right. They're very loud and they're very noisy and they get a lot of attention. And now here in New York, there is a plan possibly to call in the National Guard health workers to fill in for some of the shortages. What do you think of that? And have you ever heard of such a thing?
Yeah, the shortages are being caused by the fact that we've had this massive surge in the South. And so what that has actually meant is pulled nurses away from New England, New York, Mid-Atlantic, Midwest states to the South. That is really causing a major part of the problem. I don't think vaccine mandates are the source of the shortage, but it is unprecedented to have National Guard coming in to help. But this is the crisis we're in, and as long as the infection continues to rage in many places in the country, we're going to need stopgap measures like this.
Can we talk about the Dr. Rochelle Walensky's decision where she went against her board? We talked about it briefly last week, and she's still defending her decision. What do you make of the difference between the two?
Yeah, I actually thought she made the right call, and I didn't think it was actually a close call. You know, the advisory committee, and it's just an advisory committee, said that they did not see evidence that high-risk healthcare workers, people who are on the front lines, needed to get a booster yet. I disagree. I see the data as showing that they do. And Dr. Walensky clearly reads the data in the same way. And this is her prerogative. She is the appointed head of the CDC. So I thought she made the right decision.
But then again, you then have the problem again of the mixed messages. And I think the last thing people need who have not been vaccinated is to get mixed messages.
I totally agree, Gayle. I mean, look, the messaging on this has not been as clear as it should be. Here's the way I would think about it. First of all, absolutely essential right now that people get their first shots. If you've not been vaccinated, my goodness, you've got to go out and get vaccinated. If you are 6 months out from your second shot and you're in any kind of a high-risk group or a high-risk profession, the evidence is coming in that you probably should get a booster. And that's basically the message that we should be saying. Get the first shot if you haven't. Get a booster if you're in a high-risk situation. I think that's where the evidence is.
I can't wait to get the booster. I will try not to trample little children on the way to get in line. Thank you very much, Dr. Ashish Jha.
Yeah, thank you.
I won't, I promise. Thank you, sir, for your time.